Last time we just looked at the introduction of infertility, and in this episode we are to continue with some other causes of infertility, because specifically to be talking about causes to connect to the first episode we had, which was saying introduction to infertility. As usual, Modrix, it's me who is going to share with you, and that is the YouTube link. You can always click there to watch our videos, and many other more videos are going to be there. I just encourage you to subscribe so that you can always access them. So this is what you're going to share this time, and I request that you just give it a time and you listen carefully. It will just help you know something new, or just help you to know something to improve on what you are giving to the people. So this is our first slide, and we are saying by the end of this session, learners should be able to, and we have strictly one objective because it's quite big, mention the causes of infertility in males, females, and also in both. So what are those causes of infertility? Here we go. We are just seeing that we have these causes classified into three as our first objective. We have seen that we have male infertility causes, we have female, and also we have both. And at this time, we are going to begin with the common causes of male infertility. As we earlier said, that infertility is the failure of the couple to conceive after having coitus for a period of 1 year. Now, what are those causes? What is bringing this infertility is what you are looking at. The first one is defective spermatogenesis. And this one has a variety of causes which can make the process of sperm formation defective. The first one, it is cryptorchidism, which you call an undescended test. So when this male child fails to have this test descend, then we find that we are going to have those tests destroyed because of the temperature, which we call cryptorchidism. Initially, the tests are abdominal organs, but towards delivery, they descend into the scrotum. When they fail to descend, then the temperatures in the abdomen are going to denature them, hence infertility. Another cause we are looking at, orchiditis, and this is common in people who suffer mumps. Orchiditis, that is the inflammation of the tests, and once these tests are inflamed, they are going to fail to produce sufficient sperms, and once there is less of spermatozoa, then this other person is not going to reach the normal level of the sperms he's supposed to produce. Then we talk about also varicocele. Many people, especially gentlemen, who have varicose veins around the scrotum, these varicose veins, or many veins around the scrotum, increases the temperature, and hence they denature the sperms, and this other person is going to produce less sperms. Then there is another cause in males, which we call testicular toxins, like drugs and radiation. If you take drugs that alter the process of sperm formation, these drugs are going to make that the sperms not to be there, and this person will be ejaculating no sperm. We still continue with the common causes of infertility in male. Others are genetic abnormalities. Instead of making 46 chromosomes, the person makes 47 or 45 chromosomes, and the development is defective. Then we have another cause, which is endocrine. And when we talk about endocrine deficiency, as we well know that when there is endocrine dysfunction, then we are going to find issues in having less of testosterone, which is a hormone responsible to have all sex characteristics in males. Then we'll go next to our causes, where we talk about now the obstruction of the efferent duct. Efferent duct, this is where the sperm is going to travel to come and fertilize the ovum. Now, when it is obstructed, especially when people have TB and gonorrhea, they have this duct distracted and sperms will fail to get where to pass. Some other cause of this obstruction can be surgical procedures like herniorrhaphy, vasectomy. They have cut off the tubes and hence sperms cannot move from the test to come via the ejaculation. Then we have other causes, for example, the congenital causes. One of them is abscess of the vessel deferens. Vessel deferens, this is the tube that is connects directly to the test. And once it is obstructed or it is not there from birth, then this person will have no passage for the sperms. We still continue talking about other causes that may lead to infertility in male. One is failure to deposit sperm high in the vagina. From our previous episode, we say that for fertility to take place, sperms have to be deposited high in the vagina. And once that doesn't happen, then we are going to have them denatured by the vaginal acidity, and hence we shall have no sperm to fertilize the ovum. Then there's another problem which brings fertility we call ejaculatory failure. People fail to ejaculate, and once they have not ejaculated, then we expect no sperm to fertilize the ovum. Then there is another problem which is retrograde ejaculation. Retrograde ejaculation means this male child ejaculates within himself, especially in the bladder. Instead of having the sperm come out, they are ejaculated and they go to his bladder. And that's what we are calling retrograde ejaculation. So other causes you can talk of bladder neck surgery. Any person who has undergone surgery, especially of the bladder, can have the urethra injured and sometimes sutured, hence blocking the pathway for sperms. We can talk of drugs like hypertensives. Most of them have negative effects on the reproductive system of the male. We still talk about psychosexual, as we well know that sex is a mind game. So many people who don't link their mind to the sexual act fail to ejaculate or find themselves uninterested, and hence no ejaculation will take place. And that will be a psychological problem. Then we talk of this defect in sperm and seminal fluid. And once there is any defect, then the sperm will fail to move. The sperm will be denatured. So the above are the causes of infertility in males. So let us also look at the causes of infertility in females. As we are seeing on the projected work, that the causes of fertility in females can be related to the following. One, we talk of the hypothalamus. We can relate them to hypothalamus. It is not an endocrine gland, but at least it controls all other glands. So once it has a problem, then you are likely to have issues with the female reproductive. So we are going to share these causes basing on the projected headings. We start with vaginal factors as the cause of infertility in females. The first one is vaginal atresia. When you talk of vaginal atresia, it means the vagina is narrowed, partially or completely. It is almost not there. And this other person fails now to deposit the sperm high in the vagina, which you call vaginal atresia. There is also a problem of transverse vaginal septum. And here the vagina is divided into two septum or even several. So those different septums, they are yeast that will block the sperm to be deposited and they meet the cervix because it is partitioned, and hence infertility. Then we are going to talk about the narrowed introitus. Introitus, that's the opening to the vagina, just immediately after the vulva. Once it is narrowed, then the penis will not enter, and what will happen next? That the sperms are going to be deposited on the vulva level, and hence they are going to be denatured. Other causes of infertility in females, you are looking at a narrowed uterus or septate vagina, which causes dyspareunia. And dyspareunia, that is painful sexual intercourse. And once the person is getting painful sexual intercourse, he will stop having that coitus. Then next we talk about infection of the vagina. Especially if this person has an infection of the vagina, then he will express dyspareunia, and this will make this person now fail to continue with sex. Other causes, and I've told you that the causes of infertility are many. We may not exhaust all of them, but I will try my best to show what I can. We look at cervical factors. One of them is congenital elongation of the cervix, that the cervix is too long, and once it is too long, it makes it hard for the sperm to reach in time. It delays the sperm, and once it is delayed, now it will not reach the ampulla to fertilize the ovum. That is now the problem with the cervix. It is abnormally long, and the sperm will delay, hence infertility. Then we talk of second-degree uterine prolapse. And when we talk about the second-degree uterine prolapse, now this one blocks. And remember, with uterine prolapse, the uterus has descended. It's no longer in its real position. Now it blocks even the ureters, and they cannot be accessed. Then also talk about the cervical canal occlusion by a polyp. Once the cervical canal is obstructed by the polyp, then the sperm will find it hard to penetrate and reaches the ampulla, and hence infertility. We still talk about too thick cervical mucus. When the cervical mucus is too thick, it delays the sperm mortality. We still also look at some other things like uterine hypoplasia, and that is the incomplete development of the uterus. And once it is not well developed, then it is going to make it hard for the sperm to have a pathway, because sometimes you find it is still having some tissue which is not allowing the sperm to pass through. So we can also come to look at the tubal causes, or the causes of infertility which are related to the tube. One of them can talk about too long tubes. When the tube is too long, as I've told you, even like how we saw the cervix was too long, this also delays the sperm on the wall and eventually dies without reaching the ampulla. Then also we are talking about loss of cilia. The cilia is found in the tubes and helps in movement of the sperm and even the ovum. And once it is not there, then there is delay in movement. And that's the problem of the tubes. We still talk about other causes. For example, we are going to look at the pelvic inflammatory disease. A lady who experiences pelvic inflammatory disease has high chances of healing with scars or adhesion, and eventually is going to have the tubes blocked with this adhesion. We are going to look at some other causes. These ones are related to the ovary and the pelvic. One, we talk of peritoneal adhesion.